Persistent of neck shoulder pain among computer, office workers.
The factors that place office workers at greater risk of developing neck pain are not understood. However, elongated working hours on the computer, taking a prolonged sitting position,
and static postures were the most irritating factors. Work-related neck disorders are common problems. In office workers, the worldwide trend is for people to use computers for longer periods daily due to increased computer-based tasks at work. As
introduction of the computer into the workplace has meant changes in work organization
and a different use of worker physical and mental potential. According to the previously conducted studies around the world,
musculoskeletal disorders are the most prevalent disorders among computer operators.
The prevalence of the neck and shoulders pain is reported to be high
among workers is a national precedence in several countries
in comparison with the pains in the other limbs, decreasing work efficiency and extensive costs. However, predictors of these diseases are relatively weak. In addition, previously conducted studies have
of persistent neck or shoulder pains can be different from the etiological factors. As a matter of fact, developing appropriate programs and prevention of work-related musculoskeletal disorder, gender, age, height and weight from which body mass index was subsequently calculated, marital status, formal education, individual factors. The following individual characteristics were considered to be potential confounders: smoking, sleeping hours and leisure time, sport, and hobby. There were also statistically significant differences in the reporting of persistent neck pain across different age categories,
with the highest likelihood of pain being among those 40 to 49 years of age.
Subjects younger than 30 reported significantly less neck pain than older subjects older than 30 years of age. Individual factors:
not being physically active increased the risk of neck pain.
Women had an almost twofold risk compared with men.
Work-related physical factors were assessed by questions about the duration of employment, years at current job, hours a week, days a week, physical tiredness at the end of the day, physical workload, postures, movements and forces related to the neck region, computer use, breaks during work, and climatological conditions, noise, lack of fresh air, dry air. Work-related psychosocial factors: mental tiredness at the end of the day, job pressure, work variation and job satisfaction.
Work-related physical factors. Analyses of the association between neck pain and work-related physical factors revealed that neck pain was significantly associated with often holding the neck in a forward-bent posture for a prolonged time, various short periods of movements with the neck, often working in the same position for a prolonged time, often making the same movements per minute, often sitting for a prolonged time, dry air and temperature fluctuation and computer working time. Work-related psychosocial factors. The following work-related psychosocial factors showed a positive association with neck pain: mental tiredness at the end of the workday, shortage of personnel, not being rested after break, no variation at work, doing the same work all day, getting annoyed about others. The study indicate that physical and psychosocial work factors, as well as individual variables, are associated with the frequency of neck pain. These association patterns suggest also opportunities for intervention strategies in order to stimulate an ergonomic workplace setting and increase a positive psychosocial work environment. Sedentary activity. The majority of the employees work in an office setup, and almost all tasks are performed in a sedentary posture. A desk, a chair, a computer monitor, keyboard, and mouse, and sit-stand tables are included in the workstation. In this scenario, the association between sedentary activity and neck disorders was evaluated. Coker et al. Found that forward head posture had no significant influence on muscle stiffness, tone, and elasticity, nor did it increase the pressure sensitivity of superficial neck muscles in healthy, moderately symptomatic workers during the trial. However, Petty et al. Observed that intense physical work, awkward postures, substandard organizational ambience, and age are risk factors for neck pain. The intrinsic risk factors of office workers often will have direct and indirect intervene with the risk factors associated with the work environment impact on the emergence of neck pain. Moreover, Essany et al. Revealed that long working hours in computers and prolonged sitting and standing were work-related factors that correlated with the occurrence of neck pain in office workers. Office workers with neck pain have a poor standard of living and constraints in performing their activities, for example, sleeping, indoor and outdoor activities, carrying heavy objects, doing social activities, and driving. The lifestyle of people has changed vividly over the centuries. Initially, various work conditions were observed in the workplace, but today most people are stuck in the same place forever. Work-related musculoskeletal disorders, musculoskeletal disorder, are frequently connected with ergonomic risk factors such as contact, stress, and uncomfortable posture changes in normal working posture. Musculoskeletal disorder affect the neck, shoulders, and lower back and significantly impact a person's well-being and efficiency at work. Musculoskeletal disorder associated with work is 70-80 in industrialized countries, indicating the need for treatment interventions. Shoulder pain is the third most prevalent musculoskeletal disorder among sedentary workers, with about 21% of all complaints. Rotator cuff disorders such as bursitis, tendinitis, tendinosis, and degenerative tears are the most common causes. Rotator cuff tears, including tears of full and partial thickness, increase in prevalence over 40 years of age and are often asymptomatic. In addition, an ongoing report indicates that office workers, especially those who work on personal computers, can also have a high risk of temporomandibular disorder. Many root causes of neck, shoulder, and hand problems, including physical exposure, motionless neck, arm posture, and performing repetitive and monotonous tasks during work, are yet to be addressed. Importance of positioning the forearm while typing, and recommended that computer workers benefit by employing articulating armrests and frequent breaks. In circumstances where the forearm support cannot be placed at resting elbow height due to physical interference between workstation components or restricted desk adjustment, working in a floating arm posture may be preferable to working with forearms supported at an elevated height. One example is the banking industry, where studies show that the prevalence of musculoskeletal disorder among bank employees ranges from 60% to 80%, indicating that they are particularly vulnerable to these injuries. For office workers, the prevalence of MIST in the shoulder and cervical spine has been reported to range from 40 to 80%. This high prevalence of MIST in workers may be due to uncomfortable and rigid postures and repeated motions in various parts of their bodies. This high prevalence of musculoskeletal disorder in workers may be due to uncomfortable and rigid postures and repeated motions in various parts of their bodies. Musculoskeletal disorder is associated with both physical and mental aspects in office workers who spend significantly on computers. Assessment of sedentary activity. Studies suggest that sedentary activity increases all causes of mortality, doubles the probability of coronary disease, diabetes, and obesity, and increases the risk of bowel cancer, high blood pressure, osteoporosis, lipid disorders, depression, and anxiety. About 60 to 85% of people in the world adopt sedentary lives, making it one of the most serious, yet unrecognized, public health challenges of our day. Almost 2/3 of children are projected to be inadequately involved, with significant consequences for their potential well-being. Sitting time and increased muscle tension at work are associated with pain in the HN, leading to an unfavorable work environment. When the neck and shoulder muscles are overstrained, the effect may be a sore spine, numb arm, and cold hands due to decreased blood supply or a mixture of these. The evidence from this review suggests the need to focus on appropriate work situations to manage their tasks efficiently by controlling the sedentary activity, rather than asking workers for regular exercise. Thank you very much for watching.
Thank you very much for watching. Please do not forget to subscribe and share the video. Thank you.